What? Yeah. All right, chapter 24, daily hygiene and bathing. Daily hygiene and bathing. I think that you guys probably understand this for yourself at this age that you're at, but we do have to help our patients with this. So personal hygiene promotes comfort, safety, and health. One of the important things is to keep the skin intact. So our skin is going to be our body's first line of defense against disease. Also, our skin helps prevent microbes from entering the body and causing infection. So, also, we've talked about mucous membranes a little bit before, but there are mucous membranes in the mouth, in the genital area, and the anus that must be clean and intact. Forewarning, you're going to see lots of pictures in this lecture of what you might call private areas, or the peri areas, okay? Perineal areas, all right? So good hygiene consists of cleansing the body, preventing body and breath odors. It is relaxing to patients, and it increases circulation and really helps their overall health as well. Also, you need to keep in mind culture and personal choice are important with hygiene, and there are many different factors that can affect the hygiene needs of patients. The nurse uses the nursing process to meet the patient's hygiene needs, and you should follow the directions in the care plan as normal for this. With daily care, most people have hygiene habits and routines. Try your best to accommodate to those routines, okay? Routine care is going to be given during the day and evening. Early morning or AM care is given before breakfast. Morning care is given after breakfast. Afternoon care is done after lunch and before the evening meal. And then evening or PM care is going to be given in the evening at bedtime. You should assist with the hygiene whenever it is needed. I would say this is honestly the CNA's biggest part of their job, is hygiene for the patients. Bathing has the following benefits. It cleans the skin. It cleans the mucous membranes of the genital and anal areas. It's refreshing and relaxing. Circulation in the body is stimulated and body parts are exercised. So range of motion, or that ROM term that we keep seeing, stands for range of motion, is exercised as well. Observations are made, and you have time to talk to the patient. Okay? So there are going to be terms like complete or partial baths, tub baths, and showers are given during bathing. The bathing method depends on the person's condition, their self-care abilities, what they're able to help with, and personal choice as well. The person's choice of bath time needs to be respected whenever is possible. Bathing frequency is a personal matter again. However, we are going to encourage it, especially on our elderly care residents, at least twice a week. For a complete bed bath, you must wash the person's entire body in bed. Okay? Bed baths are usually needed for patients who are unconscious, who are paralyzed, who are in a cast or traction, or who are weak from an illness or surgery. For a towel bath, an oversized towel is going to be used within this bed bath. And then there are something called bag baths that are commercially prepared or prepared by the agency. I've never seen a bag bath actually given. Now, we do have these shower caps, and we have some of them that shampoo the hair with just in a bag. And so I will show you an example of those as well. So, one of the first important steps, I just took them back towards the back, in giving a bed bath is learning how to use a washcloth. So this is how you are going to put the washcloth on your gloved hand, okay? So you start out, a washcloth is usually a square, okay? So you're going to start out by putting your hand out like this and wrapping the washcloth all the way around your hand, okay, to look like picture C. Got it? Picture C. And then you're going to fold what's left up here over to create like a smaller square or rectangle over your hand. Then you are going to use, but each swipe that you make, then you flip one side over and you use a new piece. Okay? So this is showing you pictures of a complete bed bath. Look at the most important thing here that I want you to observe is going to be that we are going to be watching this patient's complete body, okay, in the bed. But what you should be observing right now is that the patient is still covered for privacy, okay? So you're not just having them completely out there naked. Sure, if you have the door shut and the curtain pulled, but you should still give them privacy from yourself as well and provide them that privacy during. Look, during this hair right here of the upper body, they're providing a towel and then doing their washcloth strokes underneath the towel to help with that privacy. Down here in the peri area, they are doing the same. Okay, this gives them dignity and respect and is very helpful. So this is finishing up the bed bath here. You can look and see that they're still continuing on the bed bath here. Also, you have to make sure and clean the back area as well. The patients like their back being washed the most, and sometimes they'll be like, nobody else washes my back. But we're going to do it because we should do it every time. Okay? This patient right here on the bottom is going to be a patient that's dangling on the side of the bed, and they're actually able to do it themselves. So we may get them set up for the bed bath, but they actually do it themselves. So you get their water ran for them in the basin, you get towels, washcloths, and soap for them, and help assist them in any way possible, and then give them some privacy. So the partial bath, that is going to involve bathing the face, the hands, the axilla, which is what area? It says up here, and you should just know the axilla area and the underarms, okay, or armpit area. It also involves the back, the buttocks, and the perineal area, okay? Some patients bathe themselves in the bed or at the sink, and you assist as you're needed. Tub baths and showers, you need to watch out for falls, burns, and then chilling are going to be at the risk there. Safety is going to be very, very important in these areas. Protect the patient's privacy as much as possible, and follow the nurse's directions and the care plan as well. So this is going to be two pictures of potentially two bathtubs you may see at facilities, and then you're going to see a little bit different ones as well. Like I know there's one like this, pretty similar like this to Tri-County Care Center in Vandalia that we're going to be using. And then there is one very similar to this, looks pretty identical to this at Ellsbury Healthcare Center. Okay, so I know that these are two pictures of very, very similar bathtubs. We don't have very many patients that take baths, but the ones that do, that's the only way typically that they get their hygiene in that area. They are only willing to take a bath. Now, this thing right up here is called a shower chair. We will be using this every day at clinical, the shower chair, okay? What it is a chair mainly made out of plastic, of course. You can see it's really, really sturdy. There are bigger ones for heavier patients, and we use those most commonly, honestly. And then regular size ones as well. But they allow for the patient to be sitting down to be wheeled into the shower, okay? We use these, I'm telling you, every single day, whether we're at the hospital or the long-term care resident facilities and so forth, because this is how we can keep them safe by not making them stand up the entire time and so forth. Okay, it's netted, it is wiped down in between patients and cleaned. You know what? I only used it for Tavia, and then it didn't work. Oh. It worked. His screen. Wrong one. Thanks. Thank you. Alright, so that was the shower chair. This is going to be an example of a shower here. It's really nice of some of the facilities. Say, for example, Mercy. They have like a bench here that folds down in their showers, and they have showers in their patient rooms. Okay? And so that's really nice. You're going to be seeing grab bars, potentially, and so forth. You can instruct the patients to use those as maybe you're having them bend over or do different things with them as well. Perineal care. This is also called pericare. It involves cleaning the genital and anal areas. This prevents infections and odors and promotes comfort as well. This is done daily during the bath or whenever the area is soiled with urine and feces. Pericare is very important for the patients who have urinary catheters, who've had rectal or genital surgery, who are menstruating, who are incontinent of urine and feces, and who are uncircumcised as well. Being circumcised means that the fold of skin or foreskin covering the glands of the penis was surgically removed, and being uncircumcised means that the person has the foreskin covering the head of the penis. I actually have an example in the lab. I'm not going to get it out today because we're not going to quite get to that, of a circumcised, or uncircumcised, penis. Alright, so this is showing you the example here. Just like I said, I have an example in the lab. The person does their own peri-care if they're able to. Please give them that respect and privacy of doing that, but if they can't, then that's when we have to do that. This procedure could possibly embarrass many people and staff. You should follow standard precautions, medical asepsis, and the bloodborne pathogen standard should be followed at all times. When peri-care is given, you should use warm water, not hot or not cold. You should use washcloths and towels and cotton balls or swabs according to the agency policy. You should rinse them thoroughly and then pat dry after rinsing. We always need to pat all of our patients dry instead of rubbing, okay? Their skin is so fragile, it can be very easily rubbed off, and so you should always pat them dry with a towel. So this is going to be the pictures here of basically the steps of peri-care. And this is showing you a female patient. So starting at the top here, I don't really like how they have the blanket on her, but that is the example, and it kind of gives her the most privacy across the board. So making sure a towel or sheet is across them, and then if they can lift their legs, then that's great, but if they can't, then you might have to do it without. So of course, you are going to start at the front and then move to the back or the bottom area very last with the anus area finishing up. This is showing you an example of peri-care with the penis, and this is a state exam requirement on a mannequin, okay, the female or male. All right, with reporting and recording daily hygiene or bathing, you should report the following observations at once or immediately. Any bleeding, any signs of skin breakdown, any discharge from the vagina or the urinary tract, any unusual odors, and any changes from prior observations. You should always report and record the care that is given, and if you did not record it or let the nurse know what you did so they can record it, then you did not do it. No matter if you did really do it or not. If you did not record it, it did not happen. So examples of things to report, especially when you're doing a bath, because these are the times when you're observing your eyes, your nose, you're observing quite a bit here, okay? So reporting any bruising. Could this be a normal finding, that bruise right there? How many of you guys have looked at your grandparents or your parents' arms and legs? It could be a normal finding, but go ahead and report that just in case it's not a normal finding as well. Look at this foot right here. That left foot is very, very swollen compared to the right, making sure that is reported. And then any rashes, this is a very bad rash, but a common rash that happens quite a bit. But even if this was small, okay, or even if it was one little dot of that, that would be something that you would report. So this is actually going to be a rash that has yeast on it. It's very, very common in the pannus area. And I said pannus because that's the word I was looking for. All right, so the pannus area is going to be where any skin folds over, more specifically where the stomach folds over on any of those patients with that. And that's really an area for frequent yeast because maybe washing hasn't happened correctly, or maybe it has and they just have yeast growing in that area and it needs to be treated, okay? So over here in this picture, of course, this is going to be you recording what's going on. You put an X on the picture where the area that's affected. Your bathing is documented and so forth. All right, so you are asked to help a nursing assistant give peri-care. You're gonna get asked, okay? This is part of your job. This is part of what you're doing. By the end of it, you're gonna be doing it on your own, quote unquote, okay? But you're asked to help a nursing assistant give peri-care. The nursing assistant gathered one washcloth and not gloves for the procedure. What are you gonna do? You don't know how many washcloths yet, but this procedure is gonna take probably at least 4, honestly, okay? Might not quite take that many, but yes, you're going to still do the washcloth thing and flipping over on one swipe, flipping over to the next thing. So you can use the washcloth really for like at least 4 areas before you have to toss it in the dirty linen. Does that make sense? But making sure at the end there that you're getting rid of all the dirty washcloths and so forth. Peri-care should always be done with gloves on. Okay? Gloves on for sure. Alright, so I'm going to show you this video real quick of a partial bed bath. Messed it up again.
Hi, Ms. Jones. My name is Patty. I'm your CNA today. How are you?